Good afternoon, ladies and gentlemen. I'm Ong from Taiwan. I have none for disclosure and I'm self-funded. Today, I'm proud to share with you my latest presentation on the predictive factors of adverse event after intravesical suburothelial Botox injection for OAB patient. It is a real-life practice of 290 cases in a single center. OAB is defined by ICS as the urinary urgency, usually associated with frequency and nocturia, with or without urgency urinary incontinence. The symptom of OAB might be bothersome that cause anxiety, depression, or impose economic burdens. The prevalence of OAB is highly associated with increasing age and often associated with several comorbidities. Our study is a retrospective study enrolled from 2005 until 2014 from a single center. 290 patients, OAB patients, who have tried lifestyle modification and with treatment at least 2 antimuscarinic agents for at least 3 months. 100 units of Botox A was injected intravesically into suburothelial region. Age, gender, OAB subtypes, either wet or dry, medical comorbidities and adverse events were documented. Q maximum flow rate, voided volume, and PVR volume, and voiding efficiency, I will call it VE, were recorded too. The patient was reassessed at 2 weeks, 1 month, 3 months, and every month, day after the Botox response disappeared. This is our result. The mean age of our population is 72 years old, which is considered quite elderly. 148 males and 142 females. 248 OAB wet and 42 patients OAB dry. The comorbidities that we document are diabetes, congestive heart failure, coronary artery disease, chronic kidney disease, COPD, stroke, dementia, and Parkinson's disease. The AE that we recorded is just as previous trial, most commonly AUR, acute urinary retention, and UTI. 24 patients developed AUR and 44 patients developed UTI within 3 months after Botox injection. The large PVR is considered more than 200 ml, appear in 27.9% patients at the first month after Botox injection, and 24.3% at 3 months, and the last one, 18.4% at 6 months of follow-up. This is our result. We found out that the male gender with the age more than 61 years old, baseline Q maximum less than 15, and PVR, baseline PVR more than 100, VE more than 91, has a higher incidence rate of developing AUR. Whereas for the female patient and age less than 60 years old, and PVR, baseline PVR more than 100, has a higher incidence rates of developing UTI. It is interesting that there is no significant difference between 2 OAB subtypes in the incidence of adverse event. This is the adverse event that associated with several comorbidities that we notice. Patients with congestive heart failure seems that there are higher incidence rate for developing AUR if compared to patients without congestive heart failure. Now, UTI is common in congestive heart failure, chronic kidney disease, and COPD patients. Conclusion. Male gender, age more than 61 years old, baseline Q maximums less than 15, PVR more than 100, and VE less than 90% has a higher incidence rate of developing AUR after Botox injection. Whereas women with baseline PVR more than 100 ml has a higher incidence of UTI. Our study is to provide a background to enhance the clinicians' knowledge in patient selection, and provide so they can provide better counseling for the patient about the possibility of developing AUR and CIC after Botox injections. This is my presentation. Thank you.
Thank you. Question, comments? Interesting study. Large number of male. We don't see that too often. Good.
My question is about urinary tract infections and the presence of recurrent urinary tract infections before Botox. Do you have looked at that data?
We excluded the patient with already recurrent UTI.
Are they excluded? Okay.
Other comments, questions? No? Very good. Thank you very much for your presentation.